It doesn't matter if the government tells us we're short-staffed, we don't have enough people to help look after these. But it's not necessarily all their fault. We just want to be told what the real situation is, rather than constantly be given this kind of flannel that everything's okay and they're ready to rush into action. They're not. There's not enough people. Dr. Jenny Vaughan is the Vice Chair of the Doctors Association. Sorry to bang on about this, Jenny, but it seems symptomatic of the message we get from the government, constantly saying everything's okay, when it isn't.
You're right. I'm agreeing with you.
Good.
What is going on in these Nightingale
Nothing.
hospitals? The one in London has had equipment taken out of it, and we don't have.
It's a warehouse.
Yeah, it is. And the problem is, as Danny said, I mean, I do agree with him with this. For years that we have been trying to highlight this to successive government, that we don't have staffing enough. So there were 100,000 nursing vacancies even before the pandemic. Mm-hmm. And yes, it's all very well, as he said, he's right. You know, NHS staff are there, we're ready to step up. But, you know, so many of them are burnt out. There's mental and physical health problems, but also many of them are sick. And what we want to see is some really decisive action from the government at the moment to review what we're actually getting on the front line with our personal protective equipment. And the Doctors Association has written to Public Health England today asking for an urgent review, because if it was perfect, why are staff actually getting sick? We've had lots of staff getting sick after being on call. That's what's causing the problem, why they're being thinly spread. The other thing is that there's a message for the public here to take this more seriously than they are, and to give up. People should not be going out for New Year's parties. We've now just had, you read out the figures, you know, we've just had the highest numbers of extra infections recorded, over 53,000 infections. That will then translate to a spike in January. And the question is, are we going to have enough beds? Because at the moment we are full. We are getting to be full. It is very challenging. It is very hard in the hospitals at the moment.
No, I'm speaking to Jenny Vaughan. She's the Vice Chair of the Doctors Association. I don't think anyone would expect people who've no medical experience at all to suddenly bowl up at a hospital and say, hello, I'm ready to help with all the COVID patients. But should there not be some sort of message saying, we need your help? Can you help in the smallest way? I don't know what it would be. I mean, making the staff cups of tea, anything to help more people staff these places so the real experts can deal with the real patients.
Well, what we need at the moment is we have to focus on the things that you've touched on. What is the way out of this? And one of the things that people can think about doing is, you can become an NHS volunteer. You absolutely can. If you go to the NHS website, you can sign on to that. But the other way to go to help out of this is to really, you could sign up and train to be, we will need people to vaccinate. We will need people to be helped with testing. It's the vaccination, because the way out of this, Ian, has to be that as many people as possible take that vaccine and don't start saying,
but can anyone learn to give a vaccination?
Yes,
really?
People can learn to be trained to vaccinate. And the government, I think, needs to look at this, because we are in an unprecedented situation here, aren't we? We know that. We have got millions of people to vaccinate, and we have not got enough people. We need to use the trained staff to look after the patients in the hospital, and obviously trained staff to vaccinate. But I think that's something that the government should seriously look at. We need an army of vaccinators who can do that safely. Yeah. And that will actually help, because that is the only way out, is to actually get as many people vaccinated, especially when we expect the Oxford vaccine to be approved very shortly. And that's going to be, we can then roll that out very quickly.
That's the thing. If there's one thing Britain can always be proud of, it's being available to help when there's a crisis in the country. It happens over and over again. Sometimes I feel that the message is getting out there. Right, final question. It's a bit of a kind of stark one, but Jenny, is total lockdown the only way to save the NHS?
Look, it's not working at the moment, is it? I mean, look what's going on. We're 40% of the country at least is in tier 4. Whatever we're doing at the moment is not enough. And if I was sitting in Whitehall tonight, if I was sitting where Boris Johnson was, I'd be seriously saying to myself, I don't think it's enough. What do I need to do? And we do need to look at what's going to be happening with schools in January. Do we need to send children back to school in January? Would it in fact be safer to extend that? Because there's always going to be a price to pay. And at the end of the day, people what we really need is to be able to guarantee that if you turn up at hospital, you're going to be looked after. and it's challenging already. What is January going to look like? I think we're looking at another national lockdown. I think we're looking at doing more than we're doing already, and that is up to tier 5. I think we really are. We have to face that fact.
OK, Jenny, thanks for your time. Dr. Jenny Vaughan, who is the Vice Chair of the Doctors Association.